Administering a subcutaneous insulin injection, mixing insulins in one syringe. Check physician's order and assemble equipment. Calculate the total number of units of insulins to be drawn into syringe by adding the number of units of regular insulin ordered with the number of units of NPH units ordered. Choose the insulin syringe of appropriate size based on the total number of units to be given. Wash your hands. Clean rubber tops of both vials with alcohol wipes. Remove cap from needle. Draw up air equivalent to the total amount of insulins to be given. Leaving the cloudy, the NPH insulin vial, sitting on a flat surface, inject the air equivalent to the cloudy insulin dose into the airspace of the cloudy insulin vial. Do not allow the needle to touch the medication in the vial. Withdraw your needle. Leaving clear the regular insulin vial sitting on a flat surface, inject remaining air into the airspace of the clear insulin vial. Leave the needle in the vial. It is acceptable to draw up the air volume separately. Draw up air equivalent to the cloudy insulin dose, inject all the air into the cloudy vial, and then you would draw up the air equivalent to the clear insulin dose and inject all the air into the clear insulin vial. Invert the vial of clear insulin and withdraw amount prescribed. Carefully flick the syringe to move the air bubbles to the top and center of the syringe and expel the air bubbles, leaving the needle in the vial. Assess for correct volume of clear insulin in the syringe after expelling the air. Confirm accuracy of dosage with an RN or LPN according to your agency policy. Holding the cloudy vial horizontally between your hands, thoroughly roll the vial to assure the solution is in suspension. Clean the rubber stopper of cloudy insulin vial with a new alcohol wipe. Remove syringe from vial of clear insulin and insert the needle into the cloudy insulin vial. Invert the cloudy insulin vial and withdraw correct amount of insulin, being careful to withdraw the exact amount. If too much is withdrawn, you will need to start over with a new syringe, as you cannot expel any excess. Confirm the accuracy of the dosage with an RN or LPN according to agency policy. Carefully cap or sheath the needle before transporting to client's room. Label the syringe with medication and dosage when appropriate. At the patient's bedside, perform hand hygiene. Verify correct client. Explain procedure to client. Apply non-sterile gloves. Locate the injection site. Use the abdomen on lab simulators, choosing site no closer than 2 finger breaths from umbilicus. Avoid abdominal area above the umbilicus. Grasp and bunch enough tissue to allow an area of approximately 2 inches in diameter to be cleansed and to prevent accidental needle sticks to non-dominant hand. Cleanse the intended injection site thoroughly with alcohol wipe. Use a gauze pad in the lab, moving in a bullseye motion and working outward. Remove needle cap or sheath without contaminating needle. Do not allow the cap to fall into and remain in the client's bed. Hold syringe barrel in dominant hand between the thumb and forefinger like a dart. Dart the needle quickly at a 90-degree angle. Give insulin deep sub-Q, which requires a 90-degree angle. Do not aspirate when injecting insulins or anticoagulants. Inject the medication slowly. Withdraw the needle quickly at the same angle at which it was inserted. Apply gentle pressure to the injection site with an alcohol wipe or gauze pad. Do not recap the used needle. Activate the safety shield. Discard the needle and syringe in the sharps container. Perform hand hygiene and document. Documentation would include date, time, signature, credentials, medications given, dosages given, route, injection site, and teaching learning response.